You can be the strongest nurse on the unit, the one who never cries at work, who always shows up, who always says, "I'm fine." But here's the truth. We are not meant to carry this much stress, this much grief, this much pressure alone. Whether it's burnout, compassion fatigue, anxiety, or just feeling numb after a string of back-to-back shifts, mental health support is essential, and Rula makes it possible. That's RULA. Rula is a mental health care platform that connects you with licensed therapists, real professionals in network with your insurance, and they help you get started fast. They accept most major insurance plans, and sessions can be as little as $15. Depending on your benefits, you might even pay nothing. Rula doesn't just match you with a therapist, they stick with you. They make sure you're making progress and that you're getting care from someone who truly fits your needs. Thousands have already trusted Rula to support them on their journey toward improved mental health and overall well-being. Head on over to rula.com/nursemo to get started today. After you sign up, they ask you where you heard about them. Please support the show and tell them that this show sent you. Go to rula.com/nursemo and take the first step towards better mental health today. You deserve quality care from someone who cares.
This episode is brought to you by Marshalls, where you never have to compromise between quality and price. The buyers at Marshalls hustle hard, working to bring you great deals on brand name and designer pieces. Because Marshalls believes everyone deserves access to the good stuff. Visit a Marshalls store near you or shop online at marshalls.com.
Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in school and at the bedside. So today we are talking about something that I remember distinctly the very first time I did it in the medical ICU, because I'll be honest, it kind of freaked me out a little bit, and that is a bubble study. So we're going to be talking about what is a bubble study? How does it work? How do you conduct a bubble study, or help conduct a bubble study, I should say, and a couple tips for doing it safely. So if the thought of purposefully injecting bubbles into a patient's veins makes you really nervous, stick around, listen to this episode. We're going to be diving into that now. So what is a bubble study? A bubble study, which you may also hear referred to by its more formal name, which is an agitated saline study, is a technique that is utilized to detect abnormal intracardiac or intrapulmonary shunts. And basically, it is exactly what it sounds like. It involves agitating saline with air to create micro bubbles, tiny, tiny little bubbles that can be visualized during an echocardiogram. So basically, the agitated saline, that air that is incorporated into that saline and making those bubbles, essentially acts as a contrast agent. So it shows up really well on the monitor. So now you might be wondering, well, what are the indications for a bubble study? What type of patient is this conducted on? So a bubble study is going to be indicated when a patient has a suspected cardiac or pulmonary abnormality that causes a right to left shunt. So when a patient has a right to left shunt, blood is essentially moving from the right side of the heart to the left side of the heart without first going through all of that pulmonary circulation. So remember, in normal physiology, blood's going to leave the right side of the heart, go into the lungs to offload carbon dioxide, pick up oxygen, and then come back in through the left side of the heart. If you have a right to left shunt, what's happening is blood's going basically straight from the right side of the heart to the left side of the heart. It's not really getting involved with the lungs there. And when this occurs, what you have is unoxygenated blood entering the left side of the heart and getting pumped out into systemic circulation. So you can see how that would be problematic. This right to left shunt can occur due to a PFO, which is a patent foramen ovale, an ASD, which is an atrial septal defect, and with pulmonary AVMs or arteriovenous malformations. And since a right to left shunt can lead to significantly low oxygen saturation levels, a bubble study may also be conducted for a patient who has unexplained episodes of hypoxemia. And then another common reason for a bubble study is in a patient who has had a stroke or who's having TIAs, and we don't really know why, like they don't have known risk factors such as hypertension or atrial fibrillation. So a bubble study may be conducted to determine if a PFO or a patent foramen ovale is the cause. Now, bubble studies may also be utilized in critically ill patients to aid in pericardiocentesis to make sure that the needle is in the right spot and to verify position of central venous catheters. But for the most part, you're going to see that bubble study done to look for a right to left shunt. So, just to review, some indications for that bubble study are confirming presence of a PFO, an ASD or pulmonary AVM, and the most common reason is going to be that PFO, the most common thing causing that right to left shunt. We could also do a bubble study to evaluate a patient with unexplained hypoxemia, determine if a PFO is the cause for unexplained strokes or TIAs, and also confirm needle position in pericardiocentesis and verify position of central venous catheters. So now that you've got a little bit of an overview of who we're doing this study on, you might be asking yourself, how in the world does this work? So here we go. Bubble studies are conducted during an echocardiogram. And if you're not sure what an echocardiogram is, it is a test that utilizes sound waves to create images of the heart. Basically, it's an ultrasound of the heart. And a lot of times you'll just hear it called an echo. If somebody says, my patient's going for an echo, they're talking about an echocardiogram. Now, there are two types of echocardiogram, transesophageal, which is TEE, and transthoracic, which is TTE. Now, you can imagine that the TEE, if that's transesophageal, that's going to be a bit of a more invasive procedure. And this does require sedation because they need to place that transducer into the esophagus. It's a transesophageal echocardiogram. So the most common type of echocardiogram utilized is the transthoracic echocardiogram, or the TTE. And this is non-invasive and simply involves placing that transducer on the skin of the chest wall and looking at the heart. Kind of like if you imagine somebody going in for an ultrasound when they're pregnant and the transducer is just rubbed across the belly. Same thing with an echocardiogram, which is an ultrasound of the heart. You're just not rubbing it on the belly, you're moving it around on the chest. So let's say you are a nurse and you're working in a critical care environment and you're going to be assisting with a bubble study. So it's going to be the sonographer, the echo technician, the sonographer, and you. So in critical care areas, this is often done at the bedside, or maybe you're working in an outpatient clinic, an outpatient cardiac clinic, and you're assisting with it there. So here's kind of the general step-by-step for how you would go about doing that. So the very first thing you want to do is make sure you have your supplies. You're going to need a 3-way stopcock. You'll need one 10 ml syringe that has sodium chloride in it, normal saline, so a saline flush basically. And then you'll need one empty 10 ml syringe. And I would recommend some extension tubing if you don't already have it in place on your patient's IV. Now, you may need to perform the agitation and injection more than once, so it's probably a good idea to bring a couple extra syringes of each type to the bedside. So that's step 1, getting your supplies. Step 2 is to ensure that the patient has adequate IV access. Now, I know like if you're thinking of like a contrast CT where size is really, really important, it's not as important with a bubble study from what I read as I was doing research for this article, but a 20 gauge or larger is going to be easier to utilize. It's less likely to lead to vein rupture as you do that forceful push of the agitated saline. And the most common vein used is the antecubital vein, though a central line, if the patient has one, could also be utilized for this test. Okay, so before we get into the little nitty-gritty steps of setting up your stopcock, let's take a quick break, and then when we come back, we'll dive into that. One of the hardest things about working in a chaotic hospital environment is feeling confident in what I am hearing. And when I was working with students, they had an even harder time than I did. And that is why I love my Echo Core stethoscope. Echo takes the traditional stethoscope and upgrades it with digital precision. It amplifies sounds up to 40 times and filters out background noise so you can focus on what matters. And their AI is trained on millions of heart sounds, meaning it can actually help detect murmurs and AFib earlier, while letting you record and share sounds for faster collaboration. The result? More accurate assessments, earlier diagnoses, and peace of mind knowing I'm not missing anything important. For me, it's honestly like having a cardiology consult right in my pocket. I can't imagine practicing or teaching without it. I trust Echo so much that I worked with their team to create a special offer just for my listeners. Right now, you can get up to $50 off, plus a free customizable chest piece cover at echohealth.com/nursemo. Your purchase may be HSA and FSA eligible and may qualify for CE reimbursement. Plus, Echo guarantees you'll detect heart and lung conditions more confidently. If you don't, return it for a full refund. Go to echohealth.com/nursemo for up to $50 off plus a free chest piece cover. That's ekohealth.com/nursemo.
When it comes to what your family eats and drinks, you know your choices matter. You're the expert because you know what fits your life. And getting it right starts with good information. That's why America's beverage companies are sharing more information about our ingredients at goodtoknowfacts.org. No spin, no judgments, just the facts straight from the experts for more than 140 beverage ingredients. Visit goodtoknowfacts.org.
So we've got our supplies and we've made sure the patient has good IV access. Next, we're going to set up our stopcocks and our syringes. So the first thing we want to do is take that pre-filled syringe or that saline flush syringe and take about 1 to 2 mils of saline out of that syringe. We want to make some room so that we can get some air in there as well. So remove that 1 to 2 mils of fluid and then get all the air out of this syringe. Next is step 4. We're going to flush the 3-way stopcock and flush our extension tubing if we are using it, and we're just going to flush that with regular saline. And I do recommend using extension tubing as it does make it easier to manipulate everything, as you will see as we get more into the step-by-step. Now, step 5 is we're going to attach that stopcock. So if you've never used a 3-way stopcock, basically it has 3 ports, so 3 places where you can connect something to it, and then a little, I guess it's like a little lever where you can turning it off to one direction so that things flow through the other 2 ports, etc. You're going to be manipulating the stopcock quite a bit in this bubble study. So I'll put a video or an image of that on the website, on the Straight A Nursing website, where all of this is written out so that you can see what that looks like. So you're going to take your 3-way stopcock, attach it either directly to the IV catheter or preferably through extension tubing. And then step 6, we're going to draw about 0.5 ml to 1 ml of air into our empty syringe, and we'll attach that to one side of the stopcock. So again, we have a 3-way stopcock. One section or one port basically is going to the patient. The second one now has that empty syringe with a little bit of air in it attached. And then on that third side, we're going to attach our filled syringe. So now all of our little connectors on our stopcock are being utilized. For step 7, we're going to start manipulating our stopcock. So we're going to turn it off to the empty syringe, the one that has just a little bit of air in it. And this creates a pathway between the patient and our other syringe, which is the one with the saline in it. And we're going to withdraw 0.5 ml to 1 ml of blood into that saline-filled syringe. Now, you don't have to do this. This just simply enhances contrast appearance. In some cases, they may be using some kind of contrast solution. In other cases, they're just using the agitated air and the bubbles as the contrast. So check with your sonographer or maybe your hospital policy on how this is conducted. But just know that if you're asked to withdraw a little bit of blood into that syringe, that is why it enhances contrast. Step 8, we're going to manipulate the stopcock again and turn it off to the patient. So now we have a pathway between our two syringes. Nothing's going to go into the patient right now. And basically, you take a syringe in each hand and you press the plunger on your filled syringe, and that saline, and maybe with a little blood mixed in, shoots across to what was your empty syringe. And then your empty syringe now has some blood and some air in it because there was a little bit of air in that empty syringe. And then you flush it back and forth you go, maybe 4, 5, 6 times. Get it really, really bubbly, tiny, 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 tiny bubbles. I cannot stress that enough. The bubbles should be microscopic, and it actually does take quite a bit of hand strength to do this. And if you have carpal tunnel, you definitely don't want to be doing a bubble study. But anyway, at some point, hopefully not too long because your hands will get tired, the sonographer will let you know they are ready. And that is when you open the stopcock to the patient, and you will have fluid in one syringe because you're going back and forth, right? So one will be empty, one will be full. Turn the stopcock off to the empty syringe. So now you have a pathway from your full syringe to your patient, and forcefully inject the agitated saline into that vein. Now, in some cases, you might need to do this more than once, and that's okay. In some cases, they may not get good visualization with that first injection, so they might want you to do it again, which is why you want to have extra supplies. And with the second one, they may have the patient perform a Valsalva maneuver for about 10 seconds, which you will inject during that Valsalva maneuver because that maneuver will help increase right to left shunt visibility as well. So that is your step-by-step to how you would help out with a bubble study. So you might be asking, well, what does a positive result mean? If somebody says the bubble study was positive, that means that the bubbles were seen in the left side of the heart, which is an abnormal finding. So if the bubbles appear within 3 to 4 cardiac cycles, this generally suggests an intracardiac shunt, such as a PFO or an ASD. Now, if the bubbles appear after 5 or more cardiac cycles, this suggests the patient has a pulmonary AVM or arteriovenous malformation, and the shunt is in the lungs. So in a patient with no abnormalities, the lungs absorb those micro tiny bubbles so they don't get to the left side of the heart. But in a patient with a right to left shunt, some or many of those microbubbles bypass pulmonary circulation, go straight from the right side of the heart to the left side of the heart, and do appear in the left chamber of the heart. So that's why seeing bubbles on the left side of the heart during a bubble study is an abnormal finding, and the test is considered a positive result, a positive finding for a right to left shunt. Now you might be wondering if a bubble study is safe. We are, after all, injecting air into the vasculature. So bubble studies are generally considered safe procedures with no significant risks or side effects. Now, with that said, I did see some research conducted by the American Heart Association that indicates that TIAs and small strokes have occurred in patients undergoing a bubble study who have right to left shunts. Now, it is important to note that the study does state that inadequate agitation and improper injection technique may be contributing factors for those adverse outcomes. In addition, bubble studies are considered contraindicated in patients who have a known right to left shunt due to heightened risk for air embolism in these patients. If the patient has a known right to left shunt, we have no reason to do a bubble study because we already know they have that shunt. So, a couple tips for conducting a bubble study safely. You've got to ensure that the saline is adequately agitated and that no large bubbles are in place. You also want to make sure that you're not bringing too much air into your syringe. 0.5 to 1 mil is generally the amount that is utilized. And then as you are injecting, doing that forceful injection into the patient, if you have your syringe in a vertical position so that the plunger is at the top and the tip is at the bottom, those larger bubbles are going to rise toward the top of your syringe, and you can just not push those in, right? You cannot go all the way to the pushing the plunger all the way. You would withhold those last little bits of saline that have the larger bubbles in them. And that is another reason why extension tubing makes it so much easier. You can get that syringe into that vertical position for that forceful injection. So there you have it, your quick overview of what a bubble study is and what you may need to do if you are asked to assist the echo technician, sonographer with that study. And then I do have some personal news to share. If you've been listening to this podcast for a while or listened to a lot of the episodes, you probably have heard my cat Oliver purring in the background or even meowing in the background on occasion. And I just want to let you know that you will not, sadly, will not be hearing that any longer. Oliver went over the Rainbow Bridge on September 6th, about a month after he was diagnosed with large cell lymphoma. And I have to tell you, he was such a great cat, such a good, sweet boy. Oh my goodness. And there was just nothing else that we could do. He was 15 years old. It was not going to put him through chemotherapy, which really the studies showed did not really prolong life that long. It was like it might prolong it a few months, maybe 9 months. And that was probably in a younger cat. He also had some other health issues. So we didn't go that route. We basically just pursued palliative care. And when he was clearly uncomfortable, not getting around very well, we made the decision to have the hospice vet come to the house. It was very peaceful. I pet and kissed his little face the whole time and gave him a very peaceful, loving goodbye. It was very difficult, and I can't believe I'm not crying right now. But I wanted to share that news with you in case you did enjoy, as I did, hearing his little purr every now and then. So thanks for being a fan of the show and a fan of Oliver's too. And I will see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com. If you're a new nurse and you've ever ended a shift thinking, there has to be an easier way to do this, I want you to check out Confident Nurse Academy 2.0. This is a CE-approved, science-backed roadmap designed to help you bring calm, clarity, and confidence to every shift. Inside Confident Nurse Academy, you'll find powerful evidence-based lessons that connect pathophysiology to patient care, like cardiac, the RAS pathway, oxygen delivery, and so much more, plus practical tools for prioritization, charting, delegation, and communication. You'll also get access to the Shift Strategy Workshop, where we'll show you exactly how to plan your day with intention so you can finally stop feeling reactive and start running your shift with purpose. You can join Confident Nurse Academy at one of 3 levels to suit your needs. Solo is for self-paced lessons. Squad adds on coaching and community. And then the all-inclusive tier is called Boot Camp, and this includes all the lessons, the coaching, the community, and a live 2-day immersive workshop that transforms your flow and focus and a shift strategy in real time. And right now, that bootcamp level is $250 off through November 7th with code SHIFTREADY. Head to confidentnurseacademy.com and take the next step toward leading your shift with confidence.